Welcome back to Health Matters. Parents, if you haven't started thinking about the medical care that your kids will need this fall, it's time to start. Baptist Medical Group pediatrician Dr. Seema Abbasi is here to tell you what you need to know about your kids. Welcome.
Thank you.
Now, we're getting ready for school. School has already started. They're trying to get registered and everything. So what about the vaccinations that kids need to start school? What are some of the typical shots that they need to get?
So kids who are just starting kindergarten, they need to be updated on certain booster vaccines, which covers diphtheria, tetanus, pertussis, polio booster, measles, mumps, rubella, and chickenpox. Then older children who are 11, they need some boosters again, which is again the tetanus, diphtheria, pertussis, as well as the meningococcal vaccine. The other vaccine that kids get at that age is the Gardasil, which protects you against HPV infection. Again, a very important vaccine. And then again at 16, we look at the vaccines again, and they might need some more boosters at that age.
Now, in the past, there's been all kinds of controversy about children getting vaccines and the potential relationship with autism. Where's the research on that right now about vaccines and complications?
Mm-hmm. Yes. So I think the issue that was raised about MMR causing autism, I think long ago that has been refuted. There have been many studies have been done since then, which shows that there's absolutely no relationship between the two. And vaccines are very safe. Every vaccine has a very finite risk associated with it, but by far the risks which are associated with the vaccines are very small compared to the advantage of having these vaccines on board.
So again, just going on record, there's no question that parents need to get their children vaccinated to protect the children and also to protect the other children as well.
Absolutely, that's correct.
Now, this time of year, we in our practice, in adult practice, we're talking about flu shots. Mm-hmm. And so what about children and flu shots? Do children need to get flu shots too?
Yes, absolutely. And I think children need the flu shot more so than adults. And especially because they are at a higher risk of complication from the influenza if they get the flu or influenza during the flu season. The influenza vaccines, they are recommended for all children aged 6 months and older.
Now, you were talking about getting sick, and this thought just popped in my mind, is, parents oftentimes struggle with the notion of when should I send my kid to school if they're sick. Is there any kind of guideline that we could share with parents about when you ought to keep your child at home if they're sick?
Yes. So I think a lot has to do with what kind of infection they have. So if it's influenza, you want to keep the child at home until they have been fever-free for at least 24 to 48 hours. For the sake of the child themselves, but also to avoid the transmission of infection to other kids. But for most of the other common colds and illnesses like that, there really is, all depends on how the child is feeling. So it depends on what kind of infection they have.
What about fever? They have fever, they stay home?
Yes, so if they have fever, then they should stay home until they have been without fever for about 24 hours to 48 hours.
So 1 to 2 days without fever before they go back to school?
Absolutely, yes.
Now, what are some of the ways that parents can protect their children from getting sick at school? Because I know, like now with I have grandchildren, and now I'm having diseases I haven't had in 30 years, So what are some of the things that parents can teach their children to do to protect them from getting sick?
Okay. So I think the first thing is to make sure that the vaccinations are all up to date, especially the flu vaccine at the beginning of the flu season. And then in addition to that, I think one of the most important things they can do is to make sure that they're washing their hands properly and as well as frequently. Make sure that they're having a good diet, adequate sleep, and probably when they're sneezing and coughing, they should know to sneeze and cough at the elbow, rather than into their hands, which promote the spread of infections.
Lastly, in the last few minutes that we have left, the other thing that usually comes up this time of year are sports physicals. There's a lot of kids that play sports and activities, and it's required for them to have a physical. What are some of the things that you look for and that you check when you see a child for a sports physical?
Yes. So I think it's very important for the kids to have what's called like a pre-participation sports physical, and the American Heart Association recommend that they have these physicals at least once every 2 years. And the goal of these physicals is to identify some of the health conditions which may require some kind of a treatment plan, either before they start participating in the sport or during. To give you an example, things like exercise-induced asthma. Some kids may have diabetes and how to manage it while they're playing sports. Some kids may have had history of concussion, and those are again the things that should be talked about in the process of the physical. The other goal is to identify and also rehabilitate any musculoskeletal injury that the child had previously, so that they don't injure themselves again and make it into a bigger problem.
Well, great. Well, thank you so much for being here today. Parents, listen to what Dr. Abbasi said, and that is get your child vaccinated. Next in my Health Matters memo, some tips on staying healthy as we enter the colder months. Stay tuned.